why do we do the job? And sort of, I'll throw this one at Katie and Sarah. Why are we health visitors? What is the benefits of what we do? I'll start off to make it easier for people. I do it because there is nothing better than watching somebody successfully feed a baby or get over issues that they've had right from the beginning, or actually just progress and seeing that baby grow and develop and seeing those parents change and develop. It's one of those things that, as a very experienced nurse before I did this, I've never been able to replicate in any area of nursing. It is the relationship between the parents and the child is probably the best thing you could ever see. And I think all of us who do this job, this is really our driver, is to support you as parents in doing the best that you feel you're able to do. So I'll throw it over to Katie next. Katie, what's your motivation for doing it? Why do you still?
Me, so when you first asked the questions, I think what I thought is what motivated me to do my health visiting training, and that was, so my nursing background is within mental health, and I'd spent a long time, many years working in mental health, and I'd started to see children of mothers that I had looked after coming through the service, and trying to affect change at that point was more difficult. So I think for me it was trying to come in as early as possible to be able to support families with poor parental mental health on managing that, so their baby feels secure, safe, loved, all of those things that we've talked about for the last hour, so that they don't then follow within the mental health services, trying to break that sort of pattern repeating. So that's what motivated me to do my training.
And Sarah?
For me, I was a community midwife before I became a health visitor, and I would always feel quite sad when I would discharge and then transfer to the health visiting team, and I would find myself very often sort of wandering into the baby hub to catch up with parents and mums and see them growing up, and as for me that was a big motivator to move into health visiting. And yeah, it's lovely to see a couple together or a mum on her own develop into becoming a parent with their children, and how they evolve and how they change themselves as people, become more confident. I mean, yes, and it's and that sounds a bit wrong, but when people have had problems, not that I want people to have problems, is then when you go into that final visit and you shut the door behind you and you think, great, they've done it, they've solved their own problems, okay, with a bit of guidance from me, but they've done it by themselves, and that's lovely to walk away down the garden path and think, yeah, that's lovely. Yeah.